Bipartisan Fairfield State Delegation Town Hall webinar. I'm State Rep Brian Farnan, and today we are very excited to have Dr. Charles Chip Dumais joining us. He's with the Cooperative Education Services, I think they're better known as CES, and they really are a educational support services and primarily for Fairfield County, but they really are not only a leader in Fairfield County in this space, but for the entire state. So we're really lucky to have him. And before we get to Chip, we're going to have Senator Tony Wong. He's going to provide an update on state testing and health update. And then I'll talk about the federal response, where we are now and what's next. And then Representative Laura Devlin will have a discussion about unemployment issues in the Department of Labor. And then State Representative Kristen McCarthy-Fahey will discuss the state's reopening plan. So with that, I'm going to first pass it on to you, Tony. You can lead us off.
Thanks, Brian, and welcome everyone. And again, Brian, thank you for hosting these informational sessions. And I'll get right to the data point. As of yesterday, our COVID cases in all of Connecticut is 45,994. That's a plus 81. And the COVID associated deaths are unfortunately at 4,298, and that's plus 11 from the day before. But what's important is understanding the trend, and we're talking about hospitalization. There are only 122 people hospitalized in the state, and that's a downward trend of 2. The positive is, again, we have over 400,000 tests that have occurred, and just from yesterday, we have over 6,500 tests. And again, as I repeated before, there are different counties with different impact. And so in Fairfield County, it's 15,914 cases. We have 1,371 confirmed deaths, and hospitalized is 46. And what really kind of pales in contrast, I know I've mentioned Windham County that has only 595 cases and 13 confirmed deaths and 1 hospitalization. And even Litchfield County has only 1,400 confirmed cases and 116 deaths. Before we go on, I just wanted to acknowledge and thank the governor and the Department of Education for drafting a back-to-school program. It really starts a critical and necessary conversation toward the fall opening school. And I'm really anxious to work with the entire delegation, with the Board of Education, superintendents, and the town leadership to implement these kind of requirements. But I'm really cautious to see these kind of requirements put into place from a standpoint logistics, operational, and then cost to our community. So the bottom line is the health and safety of our students are critical, and it's going to be an important conversation. I would encourage, I know Brian's going to address these issues, and there's another comprehensive draft plan that's coming out on Monday, the 29th of June. But I always see this as a draft presentation, as a real beginning of the conversation, not the final product. And I'm encouraged that the governor has allowed the fact that local input is going to be critical. And I know our Board of Education has submitted some concerns that will be addressed, and I've shared that with the governor's office. But getting back to school is a delicate balance, and we want to get there, but we want to be sure that our students, teachers, and staff, and the parents' concerns are addressed in safety. So again, Brian, thanks for doing this, and I'm looking forward to hearing some more about what we're looking to do as a delegation to benefit the community on this COVID crisis.
Thanks so much, Tony. So I'm going to move on. I'm going to talk a little bit about the federal response. The one thing I do want to give a heads up on is something we talked about in previous webinars, which is the Paycheck Protection Program. This was the program that started in the beginning of April, and it has a forgivable loan component of that. And the reason why I want to bring it up is because time is really running out, and the Small Business Administration, they're going to stop receiving loan applications on that on June 30th. And a lot of those SBA partners, they're going to need a little bit of lead time. So if you're a small business owner, and if you're interested in getting a Paycheck Protection Program loan, which there is a grant forgivable component of it, I highly recommend doing that. I would literally start that application process with your relationship bank either this afternoon or Monday. Because there's about $128 million of funds available, but obviously time is of the essence. Next, I just want to talk quickly about the CARES Act. There's additional federal funding there for schools. Connecticut will receive a block of funding from under the CARES Act for education. I think Fairfield received about $280,000, but I'm not sure on that number. And that money will hopefully be used to cover some of the additional expenses of reopening. My guess is it's not going to cover all those expenses, but it will help. And I, like Tony, want to work with our first select woman, the entire Board of Education, because when we can speak with one voice, we're much more powerful. And, we want to make sure that, Fairfield's getting as much funding as possible and as much flexibility and support as needed so we can move forward with the fall. Another thing I want to talk about is what's next for federal stimulus. A lot of people on this webinar may have received stimulus checks in the past, and the question is what's next. So sadly, the support for different initiatives is being very much through party lines down in DC. House Democrats, they passed what was a very generous bill called the HEROES Act. That includes an extra $600 a week in federal unemployment benefits to January, and then potentially another round of stimulus checks up to $6,000 per family. I think it's about $1,200 individually. The Republicans down in DC, they're taking a more cautious view on the spending, and they're looking to prioritize incentives for back-to-work bonuses instead of enhanced unemployment benefits. They're concerned about discouraging people from returning to work. What's going to happen next? Who knows? I know the president now is speaking more in favor of the direct payments. So my guess is it's going to be how the economy goes. And if there's a major setback with, a spike in COVID-19, I think we're more likely to see federal stimulus in a bigger bill. But if the economy continues to move forward the way it has been over the last month in a positive trajectory, then I think you'll more likely see a smaller legislative package coming out of DC. But I do not have a crystal ball, so we shall see with time. So with that, I'm going to pass it over to Laura. So see you, Laura.
All right, thanks, Brian. Thanks, everybody, for joining us today. Just want to give you a quick update in terms of DOL, our Department of Labor. One of the things that we've shared is over the past 14 weeks, the DOL has processed what equates to 4 years in claims. So we got to give them some sort of credit for that. But I have to say, issues continue to exist, and I will touch on those a little bit. But just to give you an idea of the magnitude of what is being paid out on the 4 programs that exist. So there is regular state unemployment for if you are laid off from a job. And about $948 million has been processed so far under that program. There are 3 federal programs that are in place. One of them is referred to as the PUA, the Pandemic Unemployment Assistance Program, and that is for individuals who do not qualify for traditional unemployment, for gig workers, 1099 workers, self-employed individuals. $83 million has been paid out so far under that program. There's also an emergency program. So if in the benefit year, that ends, I think, before July 2019, I want to say. If an individual has used all of their qualifying unemployment or been paid out, there is an additional 13 weeks of PEUC provided by the feds, and that's Pandemic Emergency Unemployment Compensation, where already $42 million has been spent. The biggest nut is the $1.88 billion that has been paid out so far under the FPUC. That's the extra $600 that has been added on to any individual who receives $1 or more of unemployment or any type of pandemic unemployment assistance. So there's been a significant amount of funds that have been issued and claims that have been processed. One sort of warning flag is that while so far I think it's over just about 650,000, 644 something claims have been processed out of or have been received, 623,000 of those have been processed. And that's a significant number, but essentially the rate of processing is slowing. So that is a little bit concerning. The DOL, and I've shared before, has been hiring, has been training, and they have a goal of putting in place a state-of-the-art sort of contact center that is targeted for mid-July. I hope they can meet this deadline. We haven't met any deadlines yet that have been shared as targets for DOL. But this will provide for call, text, chat, hopefully a real-time and fast way for people to get their questions answered. What the department has said is that they're not going to be addressing specific claim inquiries until the center is up. And I have to say, we're not exactly sure what that means. If you are having individual problems getting support for your unemployment claims, be it under the state program or one of the federal programs, if you do go to the DOL website, under their FAQ section, they have 4 phone numbers to call. They also say, keep trying, you may get busy signals. I also encourage that you reach out to one of us. If I am your state rep, or if Kristen is your state rep, or if it is Brian, and certainly for Tony, we coordinate from a Senate perspective so that we're not all pushing the same claim, because actually that slows the process. It doesn't speed the process. But if you are having an issue and can't get through, please reach out to us. Brian talked about, the funding and whether or not things will continue. July 25th is going to be kind of a key date. Hopefully claims will be declining as the state has begun reopening. So we should see more people going back to work, more people coming off of unemployment. The $600 a week add-on has been a real plus and lifesaver for people. It's also an issue of concern for the Department of Labor, the commissioner, and also for our governor, who is concerned that, it's more money than many people have made while working. So he is also floating an idea of actually incenting people to go back to work. So July 25th, that extra $600 a week essentially ends, and we'll see what happens at that point in terms of also state employment. But the big news is, I guess, is we're still watching the DOL. It's an agency that once we get through this pandemic really needs to be looked at. We shouldn't have had the issues that we've had that other states haven't experienced. They are doing yeoman's work at the same time in terms of the volume of calls. And again, if you have individual issues, concerns, please reach out to whomever of us is your representative and or your state senator, and we are happy to help.
Oh, Brian, we can't hear you, but I think you were calling on me. So
yeah. Exactly.
Oh, there you go. Okay, perfect. So thank you so much.
You missed all the amazingly nice things I said about you. I wish I was unmuted earlier.
Well, thank you. So my topic area is reopening, and it's all connected. Senator Wong started with our health data, and you may have seen some of the metrics, the Johns Hopkins data that shows Connecticut doing better than any other state in the country in terms of those new cases. And that's really a testament to what everyone collectively has been doing together, which is what has allowed us to get to where we are. I will emphasize that in terms of reopening, perspective is really important, and kind of keeping our foot on the gas. I participated yesterday. I'm part of a national network of state and local leaders, and there were a couple, 3 physicians and the dean of the School of Public Health here at Yale, who talked about the ability for us to remain reopen, and then, as we're going to talk about, going back to school, based on the big 4, as he calls it, being outdoors as much as possible, wearing masks. The only reason I don't have my mask on is I'm sitting alone here at home. Physical distance, maintaining that 6-foot separation and being aware of crowds. And then also, the one doesn't get as much play, but I like to continue to emphasize it. Some folks have chided me a bit about that, which is hand washing and hand and face hygiene. So not touching our faces and washing our hands. Those things are all still really, really important as we move forward. And just from a perspective standpoint, I want to share one other thing that he said, which I thought was really interesting, is we all tend to have extreme fear of rare events, but then we downplay or don't really pay attention to what are the common occurrences, and that's what we really need to be paying attention to. His point was, he's not afraid of coronavirus, but he is fastidious in his practice of paying attention to those big four. So as we go about reopening, what's some of the big news that's happening? Probably the fact that we can go camping now in Connecticut is not big news for all of you, the way it is for some people in my family. But this past week, we heard news from DMV, which is now reopening in some places, and all in-person services are now by appointment only. So you can go on the ct.gov/DMV website to find out where you can go and how to make an appointment. To Laura's point with DOL, we're now going to have the backlog with the Department of Motor Vehicles, and the website itself actually says the average turnaround time right now is about 4 weeks. So expect delays. The sooner you get in the queue, it's a first come, first serve. So just keep that in mind as we're going forward. I know that the big topic of this week is the reopening of our schools. And it's really great to have Chip Dumais here with us today to be able to talk more about it. Yesterday, as many of you probably know, the governor and the state commissioner released initial information with more of a long, detailed document going to be released on Monday about that. Health and safety, of course, were number one in looking at that. But I just wanted to highlight just the fact that as the commissioner presented that, the concepts of access, equity, and social emotional learning, the mental health and well-being of both our students and teachers being at top of mind as we go back and balance those needs with the physical health and safety, but also the social and mental health and safety. And I'm really grateful that that's at the top of the conversation too. The one line that I will highlight that struck me from those slides that were presented yesterday was flexibility will be the only constant. So all throughout, and you saw, and there will be more details from what we've been told on Monday about the specific metrics about how we might need to adjust once we are back in school, depending on how we do with the virus. And that's why I spent the time that I did emphasizing those big four. I'm going to continue to emphasize that, and we all have been, together with our first select woman and others. And the last thing I'll say is that just today, our superintendent, Mike Cummings, who has been phenomenal and just tremendous in terms of his communication throughout this, sent a survey out with a link to what was released yesterday. So parents of Fairfield Public School students could review that, take a look, and provide some feedback, because though the commissioner was clear in the fact that it's important to have consistency, and the governor said they're going to be looking at this from a statewide level. The implementation and the specifics of how we do things will be determined here by our central office and our teachers with input from staff, students, and parents. So for all the parents who are listening, and please spread the word to have parents go provide input, as we've been able to do through CHIP, some of the things you guys have put out in the past. And I'm very, very glad to know that we're working towards all students back in school this fall. I've never had teenagers so excited to be back to school. And with that, I will turn it back over so we can hear from Chip. We can't hear you, Brian.
I am very excited to turn it over to Chip now. He's actually someone who also worked with my my brother, who's a vice principal at Staples High School. So I'm afraid of what he may potentially know about me, but that's okay. We're going to keep this focused on education. And with that, I'm going to turn it over to you, Chip. Thank you so much for joining us.
My pleasure. Thank you, Brian. So a really important thing that as you listen to everybody who's on this call so far today is that all of these pieces are connected. And so we understand that parents getting back to work means kids getting back to school. Everybody being safe and healthy is a priority. And how do we do this and ensure the safety and health and well-being of all of these people for all this time. So it's a challenge. The second part of the challenge is that flexibility and uncertainty piece. If you were to look out the window today and use today's weather to plan an event in September, there's a good chance that things might change. And so we've been asked to plan the best that we can based on what we know the weather may look like when we end of August, beginning of September, and being flexible and prepared to pivot if we need to has really been the expectation. The governor's plan that came out yesterday, or through the State Department of Ed and the governor, yes, there's a template that'll be provided on Monday. Many districts, and just about all of them in our area, have started to develop plans for the return to school. Part of that was because we had summer school to deal with, and some of those will translate to the fall. So there are a lot of questions still in how this gets implemented well. And the biggest one is the concept of social distancing. So if all kids are going to go back to school, whether you're talking about a high school like Staples or Greenwich High or somebody else that has between 1,500 and 3,000 students and narrow hallways, unidirectional hallways are not going to be the ultimate solution. So, and I know that parents have concerns with some of the items. One of the items is that while there's a lot of guidance, maximize social distancing, enhanced cleaning and disinfection, well, one of them is face masks. And so we know that we have special populations where that's a challenge. We have young students where that's a challenge. And so how this gets implemented in schools will be something we'll have to pay close attention to. I can assure you that superintendents across the region, I just immediately before this call was on a call with superintendents, and Fran Rabinowitz as well as Glenn Longarini. Fran heads the Connecticut Association of Public School Superintendents. Glenn Longarini, the CIAC, or our athletic partners in schools. Another big concern is how we're going to deal with athletics when school starts. So they're working hard to make sure that they do individualized plans for local communities and respect the regional nature of the work that we need to do. I will say that one of their concerns is with some of these changes and requirements in place, there are costs that are associated with it. And school districts across our region have seen large cuts in some regions, and at the same time anticipated large expenses in terms of how to put the appropriate safeguards in place. So having a funding source for that is an important part of the conversation. I'd be glad to go into any particular area or answer any particular questions if that works well.
Sure. If I may, Chip, can you share a little bit about your program? Because it's a unique program. It's a supplement to the current existing education program. There's a consideration in regards to busing and a whole new configuration. Could you talk a little bit about the wonderful program that you all have? Is that all right, Brian? Just to share the unique aspect that you have as a challenge. And I think the second critical factor is safety and logistics are important, but you're going to have some significant cost considerations with safety, with sanitizing, with infrastructure changes to adapt. There's a real concern in how that's going to impact how you operate and your budgeting process.
Great. Great question, Tony. So CES, in addition to serving school districts in the area with professional development, other supports, and regional efforts, provides special education services to hundreds of students. The good news is that the class sizes, based on the needs of the students, is relatively small. So we do believe that social distancing is something we may be in a better position to do. The challenge is that a lot of our population probably averse to wearing a mask for most of the day. And so there are local challenges. We're hoping that our search for solutions to those will help districts in our region better address their special populations as well. Transportation is interesting. So the commissioner's comment yesterday on our call was a lot of students in some of our urban areas are using public transportation, and we really ought to follow the same public transportation rules for access. So right now, the current guidance from the state says full access to busing with masks for driver and passengers. So there is a little bit of angst as to how that will actually work out. The alternatives in reducing bus capacity by 50% or even 25%, the buses just aren't available. It would be very difficult and costly in order to provide additional transportation runs or to limit the capacity on buses. And I think, Tony, that gets to another piece, which is there is a segment of the population that they're estimating will choose not to return to work as an adult or not to return their children to school as parents. It's difficult to anticipate what that number is going to be. Schools are being asked to create, and we're trying to avoid parallel learning paths. So an in-school path and a remote path. Instead, maybe an in-school path with live streaming of lessons so that students have access to it if they're not in school, but it doesn't require additional teaching staff in order to do that. That would be another challenge, whether the challenge is...
Is that something that you think the teachers' unions would be open to? Because I think there may be potentially pushback about live streaming classes. I mean, I like the idea. I'm just wondering if that's going to cause some angst with teachers' unions if there is the live streaming.
So the CEA and AFT released something yesterday. There are some concerns from the teachers union with a number of pieces of this plan. And I would agree with you, Brian, that changing the structure and logistics of how we do class is something that I'm confident they would want to negotiate.
Mm-hmm. No, yeah, I think most teachers you talk to, they want to get back in the classroom too. So
CAPS, interesting that you say that, because when you talk about the nature of Connecticut and the 169 towns and the different approaches, one of the things that CES and the other rests try to do is to try to create regional solutions. CAPS is trying right now to work with their law firm in order to get the law firm to coordinate with some of these organizations, CABE and CEA and AFT, because returning to school will probably require some memorandum of agreement with the teachers union. And it would certainly be nice if the over 200 school districts didn't have to independently pay for legal advice in order to do these. But right now, those efforts are not going to result in a statewide memorandum of agreement.
So here's a couple of questions that we had come in, and this one relates to something that you already kind of touched upon, which is, what advice or resources do you have for parents who may not be ready to send their children to school full time in the fall?
So during this process, understanding that we would be out of school and everything was remote, and I hope that language is really important. When we talk about distance learning and remote learning, the phrase that I prefer to use is emergency remote learning. Schools were not prepared to do this, and simply starting up in the fall and having the expectation that we'll be distance learning experts, whether your kids are in K-12 or in college for that matter, is probably not a fair expectation. So the flexibility aspect here is important. The state and the RESCs put together resources for parents to help them through the emergency remote learning, and we would be doing the same as we went into the fall. So while individual districts would have them, the State Department would have them. The Connecticut Commission for Educational Technology has been great about putting together resources and sharing them. So I do think that there are supports that would be in place. And again, if the large portion of students are in school, then the hope is that there would be something other than simply remote learning that would help support them to keep them up with what the teachers and students are doing in classrooms.
Another question I have here is, do you think social distancing in a school setting is an achievable and realistic goal?
I am not a medical professional, but I have a physics degree, so I'm fairly good with distance and velocity and that kind of thing.
I wasn't expecting that add-on here.
There you go. So so the standard that we've been given by the state is maximize social distancing. It hasn't been maintained 6 feet, but I think 6 feet is the accepted standard when you talk to medical professionals. So that would be difficult to maintain in schools. I think even if you were to cut if a classroom has one door and there are 12 kids inside who are all 6 feet apart, and we have to pass to another class, even if we use a cohort model and they stay and somebody else comes or kids go to the bathroom, the management of keeping kids 6 feet apart would be difficult. So the maximizing piece, realistic, the 6 feet social distancing, difficult to maintain.
Brian?
Sure. Go ahead,
Tony, did you want to go ahead?
You go ahead.
So I was just going to say, back to that big four that I was talking about from the dean from the School of Public Health. So they talk a lot about the layered approach, and I know masks are a big thing. And one of the things that I've heard about on some of the calls I've been on are the potential for the use of clear masks, particularly for some of our younger and youngest students. But that's the other one that I'm going to go back to is the hand and face. And these are, I mean, I've seen some pretty funny TikTok videos that one that a teacher did about what might happen with mask wearing in elementary schools. And Mrs. Robb, I see you nodding. I don't know if you saw that one, but it's very, very funny, but it's also true. And I think I'm bringing this up because we know from behavioral health research that modeling is really, really important for changes in behavior, and just from my work in substance use behavior. So I think that's something that the more we as parents and adult community leaders can do, and we're seeing this in other places in the state, mask wearing has nothing to do with politics. It has to do with public health. So if we can help reinforce those messages, because we're not going to be able to keep kids 6 feet apart all day at school, but we are going to have them wash their hands, not touch their face, wear their masks, as part of that layering.
So
yeah, and
I'm going to jump. Okay.
Go ahead, Brian.
Go ahead, Tony. No, I was saying, I just following along. I was going to jump this question on masks a little ahead because this is one that I struggle with, and I don't know I'm not the health expert, but when I envision a second grader or a fourth grader wearing a mask all day, I struggle with that. And I obviously on the bus, egress coming in and out of the school, I totally get it. I struggle with them once they're in the class, if they are 6 feet apart, wearing the mask. But I don't know what the right answer is. I mean, maybe today with the numbers where they are, it's something we could potentially revisit. If there's obviously increases in numbers, then yes, you would need the mask, but I'm also not the expert. So I was wondering, Kip, from what you're hearing on the face mask and the fact that it's going to be mandatory throughout the day, I just wanted to kind of get your just your take on that, or what you're hearing, or the pros and cons, because I think a lot of parents struggle with that.
So getting to Kristen's point about the layers of defense here, and I think that that's one of the things that we would be relying on in society as well as in schools. So the recommendations are for enhanced cleaning, frequent hand washing and use of sanitizer, the use of face coverings. So the guidance actually says face coverings, not masks. So one of the things that some of the districts in our area are exploring are the clear plastic masks that would allow students to see a face, would not interfere with breathing and that type of thing. So there may be some alternatives or some options that would allow us to use those 4 strategies and maximize the likelihood that students will not transmit the disease.
I just want to go back to the question of maximizing, because I've gotten a lot of feedback from various educators and practitioners, so to speak. And you mentioned 6 feet, and we've been working with our gyms, which has a requirement of 12 feet. But the term maximizing could create such interpretation. And it's an incredible challenge, literally, you know, when we're looking at summer camps right now, we're only limiting 10 per group. So the idea that we're going to have to kind of change the entire structure how we're doing, and some districts may take more precaution and truly maximize the distance, where we may have to use gym space and et cetera, it's going to be a real challenge. And I think that is one of the big questions we're going to address, is a clarification of that. I think the second issue for me is, we're talking about masks, we're talking about sanitizers. These are budgetary costs because there's a shortage of those things. And we're looking at per mask unit right now that used to be 45, 50 cents now to be about $5, $6. And we're going to have to procure a lot of that. And that's an additional cost. And I did mention we're going to have some economic costs. You can't not address that from a standpoint of the impact on our municipalities and our school boards. The third critical question, Chip, I have is, we're not addressing the special education needs, the intellectual disability community, where they're going to have a much more close, intimate interaction as part of the educational process. We've really not addressed it. And I don't think the governor and the commissioner addressed that yesterday. And I think that's a real point of concern in regards to the IDD community and them getting an enriched educational opportunity, but be safe as well.
Tony, great points. And I think, remind me what the first one was.
The first one is really the interpretation of maximizing.
Oh, yes.
I found that to be very interesting, and it's open to such interpretation. You say 6 feet, you know, when we talk to the gyms, they're required to do 12 feet. But you know what? We may have schools that say, geez, we may have to have smaller class sizes, utilize gyms. If we could do classes outside, we can, but the interpretation of maximizing is really open to interpretation. Maybe some schools have more space that they can accommodate. Some more densely populated schools can't. It really is a can of worms in that interpretation.
So in the commissioner has used the word guardrails and, you know, as some of that guidance. And I think that one of the points that you hit on is the individual nature of school districts in Connecticut, and the challenge of turning those guidelines into what they'll look like in individual districts. Mm-hmm. And it becomes very hard for neighbors when you say, well, hold on a second, the kids in that town are 12 feet apart, and the kids here are 6 feet apart. Why aren't we doing 6 feet, or why aren't we doing 12 feet? So I think that those layers of response are going to be critical, because we don't have specific guidance on what the actual distance is. And there are some pieces where, as much as communities clamor for the opportunity to individualize their solutions, there is some balance between an individualized solution and some statewide guidance on what a standard should be. And the issues associated with public health should not be educational decisions. They should be public health decisions. And that's one of the challenges for school superintendents right now, who are trying to develop plans for going back to school.
So, Chip, here's a question. Oh, sure. Go ahead, Laura.
So this is in a very different direction, and I'm hoping that you can potentially weigh in on this. And it actually stems from something that I had seen on social media, largely targeted, I think, to the younger elementary grades, but the influence that parental discussions have, particularly about these issues, on their kids and their perception about going back to school. So for example, the notion of wearing a face mask all day, or personally, I cringed when you said wear the plastic shield all day. I just think of, you know, my kids who are now young adults as being in their elementary days. Oh my goodness. But the point was that kids are going to react to whatever these changes are. And there's so much uncertainty. There's so many things yet to be defined. There's positive things, there's concerning things, that it was have the discussion with your spouse or your partner away from the kids. And then, you know, when final decisions are made, sort of declare them as, hey, this is the way it's going to be. Isn't this great? You're kind of going back. But it was the influence of parental discussions and concerns raising anxiety in the younger school-aged kids. Do you have any thoughts on that that might be helpful for parents?
Sure. Another piece that's been made clear is that we're not going back to school the way it was. And the challenge there is that while physically it may appear the same, we're bringing back students and adults who have been on remote learning, quarantined essentially in their homes for half of March, April, May, and June. The social emotional supports that are necessary to get some baseline for kids to find out where they are, because we do have lots of different conversations going on at home, lots of different situations where people have been impacted by COVID, either by relatives passing away or within their families or within their neighborhoods. So an investment in social emotional supports for adults and for students would be a key add-on that's absolutely necessary and is an indicator of the fact that we're not going back to what it was. We're going back with all of these people who are in a social or emotional situation that we're not exactly sure what it looks like just yet. So, Laura, I think in addition to what advice can we give to parents, it's what supports do we put in place in school so that when students show up, we're not waiting for them to demonstrate that they had difficulty in the spring or that they're having difficulty returning. We're assessing that and we're putting things in place that will allow the transition to be highly effective.
So it might be useful as well, like, I think of the PTA organizations, Bellarmine Guild at Fairfield Prep, all of those kinds of things, that they might be able to play a real key role in providing forums or opportunities that can also help educate and inform families.
So,
in concert with what the school's doing.
And so the regional advisory teams, which are on hiatus right now, we're waiting for some guidance from the state as to what feedback. But we put together 6 teams across the state that included the parents groups like the PTAs, and they included boards of ed, and they included public health and superintendents and parents. And the great news here is that the feedback from those teams went to the Department of Ed, and you could see that the feedback was incorporated in the summer school plans that were developed. So those teams are still active. We're still having these conversations, and I feel highly confident that the feedback from those groups will go into modifying a plan for the fall that will help support families.
Can I add one more thing to Laura? I thought that was a great point that you brought up, and Chip, I appreciate your follow-up. The Social Emotional Learning Collaborative that the legislature tasked with actually coming up with a suicide assessment tool that could be used in all schools has actually broadened their conversation to be talking about exactly these issues. And Fran Rabinowitz is one of the people who's a key part of that group. As Laura, I think you're right. The role of how we as parents deal with our stress and anxiety around this, because I think we're all a little bit worried. And that goes back to what the dean from the Yale School of Public Health was saying yesterday, was it's about, managing that anxiety. And he went so far as to share some of his own personal vulnerability, and including his age, to say that he has vulnerability, but he's not afraid of coronavirus because of the steps that he's taking. We know that, again, we can't do some of those things, but I think, you're right that we are going to have to pay attention to dealing with people's stress and anxiety, and for some people, trauma that happened around this. And one of the conversations was about literally providing an assessment tool for all students and teachers as they're going back to school. So to your point, Chip, we're not waiting until October, November to see some kind of behaviors manifesting that are getting in the way of students' abilities to learn or teachers' ability to teach.
And I think that goes in part, Tony, one of the issues that you brought up about our special ed population is that I think it would be fair to say that every student, while they got what they could get for an educational experience in the spring, did not get the best educational experience that was possible. It just physically was not possible if you're not in school, you're not interacting with other students and teachers. So One of the things that I was surprised by in the spring is we initially felt challenged in how we would address our special ed population. How would an occupational therapist work, and how would our other therapists work remotely? The good news is that the results were fantastic. Families were happy and satisfied. Students had great interactions, and teachers found creative ways to connect with their students. So I think that those serve as tools and a foundation for what we can do differently when we return to school in the fall. I agree with you that there are going to be some gaps, but there are going to be some gaps for every student.
So I want to make sure I get to all the questions from coming in. So another question we received was, what are your thoughts on a hybrid focus? Could a half in-person, so I'm going to change this, and a half emergency remote learning perspective, can it be effective? Because I think right now we're all talking about, the kids are going back, but we're really not out of the woods completely to a full-time back in-person experience yet. So just kind of like, what's your take on that? And the only thing I also wanted to add to that question is, beyond just the half in-person, half emergency distance learning, would you prioritize, special education, special needs, and elementary students? And that's an issue that comes up in the discussion too. So I'm just throwing that all out at you, Chip, to see what you thought.
So prior to the state guidance coming out, schools were exploring a large number of options for returning to school. And so I'll just go through a couple of them. One might be a model where if you believe that high school students are more capable of effectively engaging in remote learning and elementary school kids less able, then maybe we get elementary school kids into school. You do K6 or K8, you spread them across the entire district for 4 days. They're home for 1 day. The high school students are home for 4 days. They come in for specialized work or tutoring on the 5th day. Well, holy cow, in order to do that, the facilities need to change. Elementary school kids going to bathrooms in the high school need to change. Busing needs to change. So a lot of those part-time solutions came with a cost that was prohibitive to districts. Mm-hmm. They're just, everyone, you start with what's best for kids and you go, well, this is best for kids, but there's no way that we could afford, estimates for some of these things, even just the estimate and the cost for PPE for an individual student for 6 months, it's just prohibitive for a district. So the hybrid models, we do understand that going into the fall, if we start with the assumption that everybody goes back to school, that there will be a percentage who will not. And so I think that the thinking has recently shifted with this new state guidance to how do we create something that can transition between full in-school attendance to full remote learning. Because if going back to school doesn't work out, if it works out, that's great. If it doesn't work out for some, we have a solution. If it doesn't work out for all, and we have to close schools again, how do we transition back? And really the best way to transition back is a good learning management system for schools that would allow you to move from in-class instruction, perhaps live video, perhaps recorded lessons, definitely a management system that allows teacher resources to be posted, students and families to have access, that you could, if you had to, transition into full remote. Oh, by the way, I don't know what that is. And I do know it costs a lot of money.
Yeah.
Yeah.
So that's the end of the questions that I had coming in. So I just, one last time, if Senator Long or Kristen or Laura.
If I may, Chip, you've been tremendous in your availability. Look, as we cited earlier, the numbers are to be laudable in what we're done in the state of Connecticut. And we should all be very proud of the collaborative effort to contain this virus. but nevertheless, it is a very contagious virus, and the rest of the country are experiencing a wave of infection. That's a real concern. And I think the other part is we talked about traditional flus that dissipates in the summer months, but we're seeing that COVID has developed some aspect of resistance, which is a real concern of a second wave. And I think, as I said earlier, I applaud the governor and the commissioner to begin this process. And I think this is simply the beginning, and we're having this conversation, but the reality is that the contagion numbers from other parts of the country, we're looking at quarantining people from other parts of the country, like Texas, Florida, that may be of concern. But the reality would be said is this: we have to evaluate day by day data points, medical facts, but all bets could be off if the trend turns in a different direction. And would that be fair to say, to share with all the people that are listening to this is a very flexible, dynamic conversation. We're putting the plans in place, but ultimately, if the numbers change and the infection rate makes a turn because of the nature of this disease that we don't know about, that all bets are off, and we have to be vigilant and be very conscious about that. Would that be a fair statement? Because that's important.
Actually, not only is it a fair statement, but let me expand slightly, is that, so right now we're essentially at July 1. And if you think about how much time is necessary to prepare for an effective, safe opening of schools, and then you compare that to how close we should be with the data in order to make the final assessment, we need much more time to make an effective plan. And so we have to start planning now for something, and it's a best guess. And as we get closer, you're exactly correct. As we get closer, we're really going to need that data from August 15th to know whether or not we can implement this plan. But if we waited till August 15th, we'd never have time to make a plan. So this is about making educated guesses based on the Department of Public Health guidance, understanding what we can do in order to best prepare. I'll use the restaurants as an example. Restaurants reopening was eat outside first, eat inside with limited capacity, and I think that's where we are now, eat inside and outside with limited capacity. But it would not be the same as opening schools in the fall and having all students go back in person. So that attention to that data, those people are going to be staying up 24/7 when we get close to school starting.
All right, so with that, I know we got 3 minutes left, so let's, I just want to wrap it up and say, Dr. Dumais, thank you so much. This is very enlightening. We're going to also share this video on Facebook, and you know, I think this is, you know, this conversation is sadly not at the end. We're probably still at the beginning of it as we go through the summer into the fall. So thank you all for joining in, and have a great long weekend, hopefully.
Keep watching.
Thank you very much for
Very much for
everybody.
coordinating this every.
I hope that this was a little bit of insight. I wish that it could have been more answers. We're just in a situation where answers are scarce right now. So
Thank
you have great people out there working on this. Thank you for what you do.